Gentlemen, I'm Dr. Luna, urologist and men's health specialist, with a full decade of clinical experience helping men rebuild confidence and reclaim their strength. And today, I'm about to talk to you about something most men go their entire lives without hearing. This is one of those topics that feels a little personal, maybe even a little awkward, but the truth I'm going to share will completely shift the way you think about intimacy, masculinity, and your long-term health. Before we get into the heart of today's discussion, do me a quick favor. Tap that like button, subscribe to Stoic Pro, and drop a comment telling me where in the world you're watching from. I love seeing this community grow, from fast-paced cities to peaceful retirement neighborhoods and everywhere in between. Now, let's get started. Here's a reality most older men never hear clearly. Intimacy does not age out. Attraction doesn't vanish. Desire doesn't expire. Yet, I constantly meet men who assume that passion fades because they're too old, or that their body is somehow failing them. But that belief is built on a myth. In most cases, challenges in the bedroom are not about age. They're rooted in small, daily habits, simple, fixable things you can change starting today. And that brings us to something men ask me about more than almost anything else. Intimate habits that feel too uncomfortable to discuss, but actually build closeness, improve performance, and strengthen trust. Over the last 10 years of treating men in their 40s, 50s, 60s, and even well into their 70s and beyond, I've seen something clearly. The moment a man truly understands how his body works, both physically and emotionally, everything changes. Couples reconnect, confidence returns, and men rediscover a sense of freedom they assumed was gone forever. So in this video, I want to break things down into simple, practical guidance. 5 truths, 5 mistakes, each one building on the next. And trust me, the first one may surprise you the most. Habit number 5, believing vaginal fluids are dirty. Let's start here because this one misunderstanding creates unnecessary shame for both partners. Vaginal fluids aren't random moisture. They are one of the most intelligently designed biological systems in the human body. These fluids come from 3 primary sources: the Bartholin's glands, which release a smooth lubrication that reduces friction; the Skene's glands, sometimes referred to as the female version of the prostate, which add extra moisture during arousal; and the cervix, which produces protective mucus that maintains balance inside the vagina. These fluids are mainly water mixed with amino acids, enzymes, minerals, and natural acids, all of which help prevent irritation, lower infection risk, and make intimacy comfortable and pleasurable. Emotionally, when a man reacts negatively or treats these fluids as something gross, it can create insecurity or embarrassment in a woman. Practically, it breaks trust and makes physical closeness feel unsafe. So, here's the mindset shift. Don't think of fluids as something dirty. See them as the body's natural signal that connection is safe, healthy, and supported. Habit number 4, ignoring taste and smell. This is easily the most common private question men whisper to me. What about the taste or smell? Here's the scientific truth. Fluids vary, and that variation is normal. Diet, hydration, hormones, stress levels, and even medication all influence the profile. Pineapple, citrus fruits, and good hydration usually lead to a milder, sweeter taste. On the other hand, foods like garlic and onions or drinks like coffee and alcohol can create stronger notes. Hormonal changes also matter. Around ovulation, the taste is usually neutral. Around menstruation, there may be a light metallic hint. After menopause, fluids may be less abundant or slightly more acidic. Emotionally, here's the key. Variation is natural. Just like no 2 men smell the same after a long day, no 2 women taste or smell identical either. Practically, if there is a sudden strong odor combined with discomfort or itching, it often indicates a very common, easily treatable imbalance, such as yeast infection or bacterial vaginosis. That's a medical check, not a judgment on your partner. The real mistake is turning what's normal into criticism. Gentlemen, acceptance is far more attractive than judgment. Habit number 3, overlooking safety. Now comes the question almost every man is curious about, but rarely asks out loud. Is it actually safe to swallow fluids? For partners who are healthy and monogamous, the simple answer is yes. These fluids are largely made of water, natural enzymes, proteins, and protective biological compounds. In fact, from a medical standpoint, this carries less risk than everyday habits like kissing or sipping from someone else's glass. But here's the important caution. Fluids can transmit sexually transmitted infections the same way semen or blood can. That includes infections such as chlamydia, gonorrhea, herpes, syphilis, trichomonas, and HIV. The risk increases if one partner has an untreated infection, and it becomes even higher if the receiving partner has open sores, irritated gums, or ulcers inside the mouth. Biologically, yes, there is a potential risk. Emotionally, honesty and transparency are what keep intimacy safe. Practically, the solution is simple. Know each other's health status, get tested together, and use protection in new or uncertain relationships. The real mistake is assuming that no symptoms equals no infection. Genuine intimacy grows through honesty, not assumptions. Habit number 2, staying quiet because of embarrassment. Over the years, I've watched couples drift apart not because of disease, but because they were too uncomfortable to talk. A small change in smell, a question about taste, or curiosity about oral intimacy. When these thoughts stay unspoken, they turn into insecurity and distance. Biologically, a woman's body changes throughout her life. Hormones, diet shifts, menopause, stress, or even a simple infection can alter her natural fluids. Emotionally, when someone stays silent, the partner feels blamed or rejected without understanding why. Practically, silence creates confusion, issues go untreated, and intimacy becomes tense instead of warm. The mistake isn't the concern, the mistake is holding it in. The solution is gentle communication. Ask questions with respect. Share what you're thinking without judgment. A little honesty turns discomfort into understanding. Habit number 1. Forgetting the emotional power of acceptance. This is the most important lesson of all. When a man accepts his partner's body fully, including her natural fluids, he sends a message far deeper than words. He's saying, "I'm comfortable with you. I desire you. I accept every part of you." Biologically, this kind of emotional security helps a woman relax, which increases pleasure, lubrication, and connection. Emotionally, it dissolves years of quiet insecurities many women carry about how their body should work. Practically, acceptance transforms intimacy from a task into a joyful, playful, pressure-free experience. Many men think intimacy is purely physical. In reality, the strongest performance booster you will ever discover is a partner who feels fully accepted. So, what should you do with all of this information? Here's a simple 3-step action plan to strengthen trust and improve your intimate life. First, have the health conversation. Suggest getting tested together, not as suspicion, but as teamwork. Twice a year is a healthy standard. Second, observe without judging. If something smells different, invite her to shower with you. Encourage hydration or support her in speaking with her doctor if needed. Address everything as partners, not critics. Third, practice complete acceptance. Remind yourself that her individuality is not a flaw. Her natural fluids aren't something to be ashamed of. They're signs of health, readiness, and trust. And if you still feel shy discussing this, let me reassure you. Every man who walks into my clinic has the same questions. Every couple worries about the same things. But when they finally talk openly, intimacy doesn't weaken, it becomes stronger. Remember this: safety never ruins romance. Safety builds reliability, and reliability creates lifelong passion. So here's the final message. Passion doesn't disappear with age. Your 60s, 70s, and even 80s can become some of the most deeply connected years of your life if you let go of shame, embrace acceptance, and take care of your health as a team. Don't waste money on risky pills or harmful shortcuts. Care for your body, communicate honestly, and embrace intimacy in its full human form. If this video helped you, hit the like button, subscribe to Stoic Pro, and share it with another man who needs this reminder. And tell me below, where are you watching from and what topic would you like me to cover next? I'm Dr. Luna, and remember, small daily choices can bring back comfort, confidence, and connection. Passion doesn't expire, and neither should you. Emotionally, here's the key. Variation is natural. Just like no two men smell the same after a long day, no two women taste or smell identical either. Practically, if there is a sudden, strong odor combined with discomfort or itching, it often indicates a very common, easily treatable imbalance, such as yeast infection or bacterial vaginosis. That's a medical check, not a judgment on your partner. The real mistake is turning what's normal into criticism. Gentlemen, acceptance is far more attractive than judgment. Habit number 3, overlooking safety.